Good evening, everyone. Thank you for taking the time to join us tonight for this webinar where we're going to talk about what we can do to fight and decrease the incidence and the consequences of cardiovascular disease. I'm sure you'll come away with lots of useful information. This webinar is provided for informational purposes only, and it's not to be considered as medical advice. If you're looking for medical advice, please seek the help of a healthcare professional, especially if it comes to diagnosis or treatment of cardiovascular condition. I'm your presenter today. My name is Ludo. I'm a naturopathic doctor. I've been around now for 20 years. Pretty crazy how quickly time flies. I studied in Toronto at the Canadian College of Naturopathic Medicine, and I've been in practice since 2004. I'm in Calgary, I'm in Alberta, and I see patients, at several different clinics, the main one being Seton Wellness. So if you want to contact me or send a patient, you can always send them there. My approach is always to try to address health problems by relying on the best research available in terms of effectiveness. I always try to look at the research, what's available, what has the best evidence, and what's the best fit to treat the patient that we're trying to help. Okay, so in terms of tonight, we're going to talk about cardiovascular health. So we're going to do a quick overview of the normal function of the cardiovascular system. We're going to look at both the circulation in the lungs, but also throughout the body. We're going to talk about heart disease in Canada, and then what can we do in terms of daily habits, lifestyle for cardiovascular disease, as for most health problems is very important. More specifically, we'll look at diet, alcohol, exercise, the importance of managing stress, and then, of course, the importance of avoiding tobacco products and smoking. And then we'll talk about some supplements that are available through Nutters when it comes to cardiovascular issues, things that can be used more to prevent problems down the road, and then specific products when it comes to blood pressure, cholesterol levels, and then supporting the heart itself and the cardiac function overall. If you have any questions, I'll answer those after the presentation. We'll have some time once I'm done if you have any questions you want to ask me. So the heart is the most powerful muscle in our body. It pumps 100,000 times a day. And of course, usually we don't realize that that's happening. Its main function is to oxygenate the blood and then send it to our tissues where our muscles will use the oxygen. It also brings nutrients and clears debris or basically end products that muscles are releasing and that have to be returned to the liver and be processed either through the kidneys or out of the blood through the liver and then the stool. So in terms of the pulmonary system, it's basically the path that's taken by the blood between the heart and the lungs. And so what ends up happening is that there's an artery that contains oxygen-poor blood, and then through the lungs, the blood vessels become very small, and then oxygen can enter into the blood, returns to the heart, and it's pumped to the rest of our body. So muscles throughout, also our organs. And once that blood once the oxygen and the nutrients have been removed, it's then sent back through the veins, and it goes back to the heart, back to the lung, and the cycle continues and continues. So in short, we want to transport blood between the heart and the lungs for gas exchange, and then the systemic circulation sends that oxygenated blood to the rest of the tissues and then back eventually to the heart. So heart disease is very, very common in Canada and throughout the world. It's the leading cause of death in Canada. Cancer, I think, is a little bit, has exceeded now cardiovascular disease as the primary cause of death. But in the world, heart disease is the leader. So every year more people die from heart disease than any other cause. There's about 17 million deaths per year, which is 31% of all deaths worldwide that are related to heart disease. The yearly diagnostic in Canada is 1 in 12, and that's per year. So 2.6 million Canadians every year are diagnosed with heart disease. There's 14 adults that have heart disease that die every hour in Canada. So again, a very common condition. It tends to affect men at a younger age. So typically between 55 and 64 is when we'll start to see problems in men. With women, it's a little bit later, typically 65 to 74. The main reason, of course, is that with heart disease, estrogen has a protective effect. And so women tend to be affected later on once they've gone through menopause. So yeah, we'll talk about some of the most common risk factors when it comes to our lifestyle. People that are at high risk of heart disease, typically we see factors such as high blood pressure, diabetes, high blood cholesterol. And so detection is pretty important because most of that is not something you can feel. And so what typically happens in my practice is someone will have a test with their family doctor, and then we'll see that they have high cholesterol levels. High cholesterol is very common. Almost 50% of adults have high cholesterol in Canada. And then similarly, some people, it's more blood pressure. And of course, people with diabetes come in to get help with their blood sugar levels. So in terms of some of the most important things that people can do to decrease their risk of heart disease, or if they have heart disease, to try to prevent future problems. Diet, of course, super important. There's two main diets that are considered best for heart disease and honestly probably for health overall. One is the Mediterranean diet, and the other one is DASH, dietary approach to stop hypertension. They're both very similar. I'll focus on the Mediterranean diet tonight. So in terms of the Mediterranean diet, typically we want to use it, or some of its main benefits are that it decreases the risk of heart disease. There's improved cardiovascular health markers. So someone that follows the Mediterranean diet, we typically see better cholesterol profile, better blood pressure, better arteries, less stiffening of the arteries, less inflammation. And the diet is also very high in antioxidants. So of course, antioxidants help to protect us, decrease the oxidation of cholesterol. So some of the key things, and I don't want to spend too much time on this, but we want to decrease the amount of saturated fat. They say to enjoy small amounts of any sweets and red meat, more poultry, eggs, and dairy, fish, and seafood, because they're high in omega-3s, are considered preferable in terms of sources of protein. And then the diet is high in whole grains, legumes, fruit, vegetables, healthy fats, herbs, and spices. And then it also includes a recommendation for cardiovascular exercise. Cardiovascular exercise is a major problem in Canada. There's only 1 in 5 Canadian that exercise on any given day. The recommendation is to get at least 150 minutes of moderate exercise per week, so about 30 minutes 5 times a week, and then 75 minutes of more vigorous intensity exercise. And then smoking cessation, of course. If you smoke, unfortunately, the smoke really increases the risk of heart disease. Basically, the smoke leads to stiffening of the arteries and really increases the risk of having high blood pressure, increases the risk of plaque, and of course that leads to can lead to heart disease and increases the risk of having a heart attack. Stress management is something else that's really important. People that are under lots of stress typically have a harder time coping. They tend to eat poorly. Foods that are high in calories, so things that are that contain unhealthy fats or sugar we tend to crave those if we're very stressed because they're high in energy. And so the diet usually becomes worse with more stress. The other thing, of course, is alcohol, and the new recommendations are to try to limit alcohol to 2 drinks a week. Prior to that, the recommendation was no more than 10 drinks per week for women and 15 for men. There is some benefit with alcohol when it comes to heart disease, especially red wine, because of the antioxidants it contains. But one thing that's important to remember is as soon as you start increasing the amount of alcohol, your risk of cancer increases. So we don't want to use too much alcohol. Other things that are really important, maintaining a healthy weight. I think that's one of the biggest challenges we have right now in Canada when it comes to heart disease and diabetes, obviously. If you weigh more, chances are your cholesterol will be higher and also your blood pressure. So those are the key things that we should all do to be healthy, and certainly to protect our heart, and even more important for those that are already at risk because they suffer from heart disease. We want to try to follow as many of those as we can. So in terms of supplements for prevention, there's 2 that I want to talk about tonight. One is the garlic, and we've known for a very long time now that the plant has all kinds of health benefits in humans. It helps protect us from infections. There's research with cholesterol. It helps to support digestion. The active ingredient is allicin, and so extreme care must be taken when we process garlic to make sure that it's done properly and we can preserve this key sulfur compound. We think that it helps to decrease cholesterol through nitric oxide, which is a vasodilator, blood pressure through nitric oxide, which is a vasodilator. But we also think that it has an important role in high cholesterol levels. And there's studies available, of course, and 12 studies now that show about a 12% reduction in total cholesterol with garlic over placebo, which is substantial. The reduction was seen after 1 month, so it doesn't take that long. And even after stopping the supplementation, the effect was seen for 6 months, and so quite powerful. The largest study so far was done in Germany, and mean serum cholesterol decreased by 12%, and then triglycerides dropped by 17% compared to placebo. So triglycerides are another fat that travels in the blood, but unlike cholesterol, it's not attached to protein. Triglycerides, though, are associated with similar risk when it comes to heart disease. If we compare it to cholesterol, very similar. There's more fat in the blood, there's an increased risk of plaque. In terms of the garlic, usually the recommendation is 1 capsule 3 times per day. The organic cardiac health is the other product that I want to discuss. It's essentially a tincture that contains 8 different nutrients or plants. And so those are the garlic, hawthorn, mistletoe, motherwort, cayenne, willow, and bilberry. And so basically it's a tincture. So it's an alcohol extraction, non-GMO sugarcane alcohol extraction that's done over a 3-week period to maximize the isolation of the biologically active and beneficial compounds we're looking for. So of course, garlic, we just mentioned, all kinds of benefits for heart health. Hawthorn, one of the most commonly used plants when it comes to the heart. It's considered to be a tonic, so it typically helps in terms of cardiac function, the pumping effect of the heart. Mistletoe helps blood vessels, and so good research there in terms of preventing plaque or stiffening of the arteries. Motherwort also has lots of research when it comes to cardiovascular health. It also hinges on antioxidants and nitric oxide. And then cayenne, of course, we know helps with circulation. It's a spice that is very vasoactive. Willow is a precursor basically to aspirin, which has a profound effect on clotting. So it helps decrease the risk of a blood clot. And then bilberry, of course, contains very powerful antioxidants that are called anthocyanidins. And antioxidants, we know, help to protect the heart, decrease the oxidation of cholesterol, like I was saying before. Typically, we recommend 1 to 2.5 ml 1 to 3 times per day with food for the organic cardiac health formula. Next, we're going to look at blood vessel function. And so you can see here the difference between an artery and a vein. Arteries basically carry the blood away from the heart. When we look at the artery, it has 3 different layers, and it tends to be more elastic because the artery gets a lot of pressure because it follows the pumping of the blood from the heart, and so it has to stretch more. And that's where if the arteries stiffen, it becomes a huge problem, because then that pressure is not absorbed by the blood vessel and the blood pressure starts to rise. Higher pressure is harder on the arteries and it creates tears and nicks. And then that's where we can end up with plaque. Once we go from the artery, we go through capillaries, and the capillaries are very small blood vessels. They're found in our brain, they're found in our organs, but also in our muscles. And that's where the exchange of air and nutrients occurs. In the case of a stroke, it's usually a small capillary that would burst inside the brain. And of course, blood is not supposed to hit the brain like that. It causes damage to the brain, and it can be a very serious problem. And the veins carry the blood back towards the heart. And so once the blood goes through the capillaries, it goes into small veins, and from there it's transported back. The veins have the same 3 layers of muscle and connective tissue as the arteries do, but they have less muscle, and so they're not as stretchy. As soon as there's damage to the artery wall, we end up with an increased risk of buildup of plaque. There's typically different ways the arteries can be damaged. Of course, there's oxidative stress. So again, oxidants, free radicals, and that can come, of course, from smoking. It can also be related to the food you're eating, trans fat, fried foods, processed foods, lots of sugar will damage the arteries quickly. High blood pressure, as I was mentioning, it's just more pressure. And so just like a pipe that's under more pressure, if the arteries are under more pressure, more likely to create some damage and hardening. High cholesterol can deposit into a tear into the artery wall, and then we end up with plaque. Inflammation is bad for most things, obviously, in our body. Inflammation creates damage to the artery wall and increases the risk of artery disease or arteriosclerosis. Homocysteine is a protein that we make every day. It's a normal part of metabolism, and typically it's recycled by methyl donors, things like B vitamins and folic acid. If it's too high, it's really not good for arteries, and it also increases the risk of blood clots. And then, of course, diabetes causes a lot of damage to arteries and blood vessels overall. When there's lots of sugar floating around, it binds the collagen together, and then the collagen loses its elasticity, and then we end up with hardening of the blood vessel. And that's why in diabetics, there's often going to be complications with heart disease, problems with peripheral blood flow, and also vision, because the blood vessels in the eye can burst because of that. So if we look at some of the supplements we can use to support the health of the arteries. Grapeseed helps to prevent damage to blood vessels that's going to be caused by oxidative stress. The grapeseed contains proanthocyanidins, and those are 15 to 25 times more powerful than vitamin E when it comes to neutralizing free radicals. And of course, that protects oxidation of cholesterol. The proanthocyanidins we know can help in terms of improving blood flow in small blood vessels and also blood flow through the brain, through the heart. It helps prevent capillary fragility. So again, blood vessels breaking, especially in diabetes. It helps with blood flow in the extremities. It helps prevent platelets from sticking together, so decreases the risk of a blood clot. It helps protect the eyes. It helps with edema, especially in lymph nodes. It helps with varicose veins. And because it's such an awesome antioxidant, it can be considered as an anti-aging product as well. Typically, we would use one per day. And usually we want to use it for at least a month before we can assess its effectiveness. The beetroot contains two natural red pigments. So again, the anthocyanidin and the betalain. They're very similar. The betalain is a good antioxidant. It helps protect blood vessels. And so they tend to have, those two pigments tend to complement each other when it comes to supporting cardiovascular and more specifically arterial health. One of the most important things that I do in practice is help people with their cholesterol. As I was saying, it's a very common problem. People that get regular screening will of course be aware when their cholesterol is too high. About 50% of Canadian adults have high cholesterol at least at some point in their life. And we know now there's lots of research showing that cholesterol will increase plaque. And of course, with more plaque, there's more risk of plaque rupture, which then leads to blood clot. So elevated levels of, especially LDL. So LDL stands for low density lipoprotein. So that protein basically has a little bit of protein and a whole bunch of cholesterol on it. And so if LDL is high, that LDL floats around and is shedding fat in the blood vessels and increases the risk of having issues. High cholesterol, of course, can be from lifestyle, poor diet, obesity, but there's also genetic predisposition. And there's a specific gene called ApoE, and some people can have a genetic defect or mutation. And people that have a double mutation of that gene have a much higher risk of high cholesterol, heart disease. It's also not good for longevity and increases the risk of Alzheimer's also because of its effect on lipids. So those are all things to consider. The cholesterol will then can build up in the wall of the arteries and then lead to plaque. Plant sterols are an excellent way to prevent this because they basically compete with absorption of cholesterol. Plant sterols, cholesterol, so one is fat from plants, one is fat from animal. The plant sterols will block absorption of cholesterol. And so I don't know if you've seen the ad, for example, with Becel, which is margarine. They say, oh, it's heart healthy, which of course is not a great fat for your heart. But the reason why they say that is because they've added sterols to it to decrease the absorption of the nasty fat that's in the product. So of course, accumulation of cholesterol in arteries is central to the process of heart disease, especially coronary heart disease in the heart, and then stroke. Of course, strokes can also be caused by an aneurysm, and that's different. You're born with that. But in terms of an occlusion or blood clot that travels and causes a stroke, that cholesterol is the main risk factor there. So basically what can happen is formation of plaque, and then that plaque, as you can see in the slide, can rupture, and that can travel and then lead to a stroke or heart attack. With more cholesterol, there's reduced arterial elasticity. So the cholesterol buildup prevents or makes the wall stiffer. And so we lose that ability to absorb the pressure, and then blood pressure increases, which compounds the problem associated with high cholesterol in the first place. And then if we get narrowing, we get reduced oxygenation of tissues. So think of angina, right? Like the person has chest pain because the heart muscle is not getting enough oxygen because one of the key vessels is occluded or partially occluded. And so we want to do what we can to prevent cholesterol buildup in the arteries, because it's one of the main problems, and it's also the main risk factor in Canada when it comes to heart disease. So some of the products we can use for cholesterol management, cholesterol, which I use all the time with patients. Excellent formula, usually see significant reductions in cholesterol levels quite quickly. It contains red yeast rice, Google sterols, plant sterols, oat, green tea, and all of that helps to lower LDL and also total cholesterol. Yeah, so in terms of just the sterols alone, decrease in total cholesterol by an average about 10% in 16 studies published in the literature, and then LDL cholesterol by about 15%. So quite a significant reduction. Typically with the cholesterol, we recommend using 2 soft gels twice a day with food. And like I said, it's usually quite effective at increasing or decreasing bad cholesterol and total cholesterol. I always also usually see it decrease triglyceride levels. Another product is the straight sterolins with the arabinogalactan. Arabinogalactan is one of the most studied fiber when it comes to lowering cholesterol. So basically, cholesterol is in the blood, it gets taken to the liver then puts it in bile. From bile, it's excreted with stool, and we reabsorb quite a bit of that because it's released in the small intestine, and the small intestines will reabsorb fat. So the arabinogalactan will bind to the cholesterol in the gut and prevent it from being reabsorbed. So it acts like a sponge, therefore decreasing cholesterol levels. And then I talked about the sterols before. Basically, they prevent the absorption of dietary cholesterol and directly compete with cholesterol for absorption. So sometimes I tell people, especially if you have a meal that's high in dietary cholesterol, probably a good idea to use a product to at least decrease the amount you're going to absorb. Typically, we tell people to use 4 capsules 3 times per day with meals. Again, especially if it's a high-fat meal. The other product is sterols and sterolins. And here we're looking at the highest amount of free plant sterols, so 350 milligrams for lowering total and LDL cholesterol levels. There's also flaxseed oil, which contains some omega-3s, and it's in a soft gel. And usually the soft gel is more slippery and it's easier to swallow. Both of those products will help to decrease cholesterol through the mechanism I just explained, interference with cholesterol absorption. And then there's 2 sizes available, 60 or 120 soft gels. The last section was on cardiac function. So there we're trying to support the heart muscle itself and then blood flow through that muscle as well. Often we'll assess cardiac function through blood pressure and also heart rate. Blood pressure though is one of the key things to look at. So, basically we're looking at systolic, which is when the heart pumps and sends the blood throughout our body, and then diastolic, when the blood is filling the heart and when the heart is at rest. So that's the lower of the 2 values. Normal is considered 120 or less, and 80 or less in terms of systolic, diastolic. We have lots of problems with blood pressure in Canada. I see elevations all the time, and sometimes very, very high levels. Basically, as soon as you're above 120 and above 80, your risk of heart disease and of overall death increases. And very, very high blood pressure significantly shortens your lifespan or your life expectancy. So you can see here, stage 1 is 130 or more, and then so on and so forth. A hypertensive crisis is typically when in my office, I would try to lower it with the patient through relaxation. But if it stays that high, it's considered a medical emergency, and typically we want the patient to see a doctor or go to the hospital for treatment right away, because it's considered to be very, very dangerous in terms of heart attack. So what causes high blood pressure or hypertension? There can be several causes, although in most of the time we're not 100% clear why this is happening. We do know that there's a genetic predisposition. So if you have a family history of hypertension, it can increase your risk of having that condition as well. We think that certain genes are involved with the regulation of blood pressure. And so if you've inherited a gene that's defective, your risk of having hypertension increases. Of course, unhealthy lifestyle. So if you eat too much salt, too much fat, too much sugar, unhealthy fats, especially if you don't exercise, if you're overweight, if you drink too much alcohol, or if you smoke, your risk increases significantly. Stress, of course, when we're stressed, blood pressure is very high. It's one of the things that happens through a stress response. So sometimes, we'll put a 24-hour monitor on a patient, and we'll see, for example, that at work, if it's a stressful day, the blood pressure level stays high for hours, which is obviously not ideal. Age is another important risk factor, of course. The risk of hypertension increases as we age, mainly because the arteries tend to stiffen over time. And then, of course, when that happens, blood pressure increases. And then there can be other medical conditions that really increase the risk of having hypertension. If your kidneys are not filtering properly, your blood pressure is likely to increase. If you have type 2 diabetes or diabetes overall, because higher blood sugar can damage arteries, it can increase your blood pressure. Sleep apnea now, we know really can increase blood pressure significantly. High cholesterol, problems with your thyroid, problems with your adrenal glands, certain medications, the most common one being an NSAID, so things like Advil, for example, we know now they can increase blood pressure, especially if they're used every day for a long time. Cold medicines, decongestants also increase blood pressure. Pollution, because it's not good for our blood vessels, it increases free radicals. Uncontrolled hypertension can have a significant impact on your overall health and your long-term health. Increases the risk of heart disease, kidney disease, increases the risk of blindness and eye problems. It increases the risk of stroke, obviously, and we want to avoid that, obviously, for obvious reasons. We also know that a lot of the risk factors for heart disease, also risk factors for dementia and Alzheimer's. And so high cholesterol, high blood pressure, both increase the risk of dementia. And then, of course, it can lead to other problems like anxiety, depression. There can be problems with blood pressure during pregnancy, and that's usually called eclampsia or preeclampsia. And so typically, it's important to monitor your blood pressure, especially as you get older. So in my patients that are over 50, I'll sometimes tell them, this is probably something we want to monitor a couple times a year if it's normal. And then if we see elevations, we'll often monitor a lot more weekly or even more if blood pressure is extremely high. So what are some of the things we can use to support the heart? So CoQ10, of course, is well researched. It's an energy metabolite, and so it's part of the electron transport chain, which is a way we make ATP. And so it helps to support energy production in the heart. It's also an amazing antioxidant. And reduced levels of CoQ10 are not good for brain either, so it can lead to memory loss and impair cognitive function. We tend to have a hard time producing it, or harder time producing it as we get older. So it can be critical for especially older patients to use it. The other thing that I find, of course, that we know is that if someone is taking a statin to decrease cholesterol, it will inhibit the production of cholesterol, but also CoQ10. So in those patients, it becomes very, very important to make sure we supplement. And, you know, each 100 milligram capsule of the New Roots Herbals CoQ10 is standardized to meet the body's need for this coenzyme. That's critical for all metabolic function. So you can see here, it's available in 100, 200, and 300 milligrams. The typical dose used in research is 300 to 400 milligrams per day. Some people can be sensitive to it, and if they tend to get queasy or if it upsets their stomach, typically we'll use 100 milligrams 3 or 4 times a day. And then for people that can tolerate 300, no problem. Sometimes I'll tell them to take 1 in the morning. And if I want to use 400, often I'll use the 200 twice a day if the patient can tolerate it. In terms of dose, again, most research 100 to 300. For things like memory, sometimes I'll use more. For heart failure, I'll use more. So it depends on the use and if we're using it more to support minor issue, or if there's more serious problems, then I'll tend to escalate the dose. We typically want to use it for at least 3 months before we can reassess its beneficial effects. For the hawthorn, we talked a little bit about it before in the tincture we mentioned. So it's one of the most valuable cardiovascular tonics available. The berries are very rich in flavonoids, and the flavonoids dilate blood vessel, and that includes peripheral, but also the coronary blood vessels, so the blood vessels in the heart, and that helps with hypertension. It can reduce angina, so patients that have chest pain because there's inclusion in one of the coronary vessels. Hawthorn is usually very helpful. Hawthorn also has the procyanidins, and they tend to reduce spasms. It's considered a cardiotonic, as I mentioned before, and so it helps to support the energy production inside the heart, and so helps to improve the ability of the heart to contract. It's used sometimes for irregular heartbeats. It can also be used for insomnia. Typically, we would use 1 or 2 capsules twice a day with a meal. And then the last one the last product that I want to talk about today is the taurine. And we find taurine in brain tissue, the eyes, the heart. It's also found in platelets. It plays a role in clotting. It's an amino acid, obviously. It acts as a buffer, pH buffer, and so it helps prevent an acidity buildup in muscle, including the heart. Like I said, it has a role in clotting. We think that it's important for bile acid conjugates in the liver, so important for fat assimilation, absorption. And it also helps to get rid of unhealthy cholesterol. It's typically important to support function in the heart, and deficiencies are typically a problem for brain and heart function. So typically there we'd use 3 capsules once or twice per day. So that's it in terms of the presentation.